Good day, dear students. I am Chimidronov Sergey Nikolaevich, the head of Human Anatomy Department in Samara State Medical University, and today we'll talk about skeletal muscles and the part of anatomy which call myology. And so the first lecture you will see on this page, common anatomy of muscles. The mobility of motor function of the organism as a whole is indispensable condition for life. This function is provided by the musculoskeletal system, in which the muscular system performs an active function. In addition, the muscular system provides movement of body parts relative to each other, movement of organs, provides many vital functions: breathing, swallowing, protects internal organs, muscles of the abdominal wall. Muscles have a firm bonding effect not only on bones, ligaments, and joints, but also on internal organs, blood vessels, as they cause an increase in metabolism. The muscular system is the effector apparatus of the nervous system. Sechenov, in his book Reflexes of the Brain, wrote, "All the infinite variety of external manifestation of brain activity is finally reduced to only one phenomenon: muscle movement. Functionally leading in the muscular system is the muscle tissue. According to the morphofunctional classification, muscle tissue is divided in two main groups: smooth, non-striated fibers and striated fibers. And also striated fibers divided in two groups: skeletal muscle tissue and hard muscle tissue. All these kinds of muscle tissue you may see on this page. On the left picture you may see smooth muscle tissue. At the middle you may see hard muscle tissue, and on the right side you may see skeletal muscle tissue. So more detailedly, the tissues, also muscle tissue, will study on histology. Contractility is a specific property of muscle tissue which is ensured by the presence of a partial contractile apparatus in them. Smooth muscle tissue is involved in the formation of a number of internal organs, is located in the valves of blood and lymph vessels. Smooth muscle cells and smooth muscle cell myocyte, it's the name of this cell, is a structural unit of smooth muscle tissue. And so smooth muscle cells or myocytes are mononuclear sites and has small size. Their average length is about 500 microns. Their thickness is about 6 microns. Functionally, smooth muscle cells are characterized by involuntary contraction. They are innervated through the autonomic nervous system. So smooth muscle cells, I told you, detailedly will be studied on histology, where we will study internal organs and blood vessels. Directly under the muscular system is understood a set of skeletal muscles which, when contracted, provide locomotion, the movement of the body and its parts in space. In the human body there are more than 400 skeletal muscles that occupy a certain position and provide various movements. Muscles make up, in a trained person, 35–40% of the total body weight. A trained person can reach half of body weight, 50%. So next we'll talk about development of skeletal muscle. As you know, on this lecture we'll tell only about skeletal muscles. And I told you that smooth muscle tissue you will study where we will study internal organs and blood vessels, and also heart, cardiac muscle tissue. You will study when you will study heart, cardiology. But now we only learn about skeletal muscle. And let's detailedly talk about development of skeletal muscle and skeletal muscle tissue. So, the source of development is the dorsal mesoderm, located on the sides of the notochord and neural tube. At the end of 3 weeks of embryogenesis, the dorsal mesoderm begins to divide into primary segments, somites, which are separated from each other by myocytes. In black, um, you may see somites, and uh, in white, you may see septs with connective tissue, myocepts. So, the dorsomedial part of the somites, myotomes, growing is divided in two parts, dorsal and ventral. The back muscles develop from the dorsal part, and the muscles located on the anterior and lateral surfaces of the trunk develop from the ventral. Moreover, muscle development is closely related to the development of the nervous system. Branches of the spinal nerve formed at the same segmental level grow into each myotome. The initially developing muscular system has a pronounced metametric structure. Gradually, the features of metamerism are gradually erased. So you may see metameric um, kinds of muscle system in embryo. You may see somites and myocytes, as I told you, and all of them pronounced metametric structure in fetus. So, muscles that developed at the site of formation are called autochthonous. The autochthonous muscles developed at the place of formation. It's very important. This is how the muscles of the trunk and head developed such autochthonous muscles. The mesenchyme is involved in the formation of the muscles of the limbs. Moreover, during the formation of the limbs, there is a displacement of the formation areas. So, truncapital muscles develop from mesenchyme of the germ of limbs and move from the limbs to the trunk. This includes the muscles of the chest, the latissimus dorsi of spine. Other muscles form on the trunk but are subsequently displaced to the limb. They are called truncafugal muscles uh, that begin to form on the body, but subsequently, as I told you, shift to the limbs. This includes the rhomboid muscles, the muscle that lift scapula, musculus levator scapulae. Most muscles arise from the union of the muscle sides to form multiple myotomes. These are polymer muscles. The rectus abdominis muscle, for example, consists of individual muscle section connected by a tendon bridge, the remnants of myoseptum between individual myotomes. And I will show you this muscle later. The formation of the muscle of head and neck is more complex. They develop from the head myotomes whose cells migrate to the region of the developing visceral arches. This part gives rise to the so-called bronchogenic muscle group, developing around the branchial arches. Some muscles, trapezius and sternocleidomastoid, are displaced to the trunk. This also as a group of truncapital muscles, masseter and mimic muscles develop to the site of the visceral arch. The formation and development of the diaphragm occurs at 3 weeks in the form of septum. which is formed from the cervical myotomes. As the heart and lungs developed, the diaphragm shifts caudally, lower. However, its connection with the cervical segments remains since it's innervated by one of the branch of cervical plexus. In a newborn, of the muscles are formed, but the muscles in general are poorly developed, accounting for about 22% of the body weight. Muscle development in postnatal ontogenesis is uneven. The muscles of the neck begin to strengthen first, ensuring the retention of the head. In general, the muscles of the caudal parts of the body grow faster than the cranial ones. The muscles of the lower limbs grow faster than the muscles of the upper limb and trunk. On the limbs, this is a distal proximal gradient. The muscles of the hand and foot develop faster. For a long time, the muscles of the back and abdominal wall remain weak in children. Weakness in the muscles of the back leads to a stock posture, and weakness in the muscle of the anterior abdominal wall makes it easy for hernias to occur in children. Muscle growth after birth occurs primarily as a result of thicker muscle fibers. In newborns, the thickness of skeletal muscle fibers 7 or 8 microns. In the second-year-old of life, 10-13 microns. In 4-year-old child, 14-20 microns. In adult person, on average 40-60 microns, and sometimes 100 microns. So next we'll talk about muscle as an organ. Musculus, it's in Latin. What does it mean organ? And what does it mean muscle as organ? It develops from one or more myotomes, occupies a certain position in the body, has a definite shape and attachment. During its contraction, it changes the position of certain parts of the body. The main structural element of skeletal muscle is muscle fiber. You may see this fiber on this picture. And so the muscle fiber is a unit of skeletal muscle. It's elongated cylindrical formation with pointed ends, with a diameter from 10 to 100 microns, variable length from several millimeters to 10-30 centimeters. The diameter of muscle fiber depends on belonging to a particular muscle, for example, thin and oculomotor muscle and thick and back muscles. Next, gender, thicker in men. Age, after birth they thicken in 10 times. Next, human nutrition, functional load, hypertrophy or atrophy. Muscle fiber is a complex formation which consists of two main components, myosymplast and myosatellitocyte. Muscle as an organ consists of muscle fibers connected together by a system of connective tissue, blood vessels, and nerves. So you may see the muscle fiber of first graduate, and also you may see these fibers, structural units in skeletal muscles here. This one, and other. So, as I told you, each fiber is covered with sarcolemma and surrounded by endomysium, a little piece of connective tissue between these fibers, the thinnest layer of loose connective tissue, then contains blood and lymphatic capillaries and provides fiber trophism. The collagen and reticular fibers of the endomysium are woven into the basement membrane of the fibers. Perimysium surrounds the bundles of muscle fibers. It contains larger vessels. You may see the muscle fibers of second graduate, which cover with perimysium, is more thicker uh, layer of connective tissue with blood vessels and nerves here. You may see, for example, on this picture. So epimysium is the external connective tissue that grows together with the fascia surrounding the entire muscle. So you may see in letter 1, this is epimysium, which covers the muscle in whole and form the muscle fiber or muscle whole in third gradient. Muscle fibers form the working part of the muscle called the body or venter. So you may see the venter or abdomen or caput here. The muscle of the simplest form, a head or abdomen or body, also has tail, tendon. You may see that the simple muscle, this is fusiform muscle, has two parts, abdomen, head, and tail, tendon. It's like mouse, animal mouse. So each muscle at one end connects to one bone, the beginning of the muscle, and the other to the other bone, muscle attachment. A muscle starting on one bone and attaching to another is through our joint or other movable joint of bones. It so happens that the concept of the beginning and attachment of muscle is rather arbitrary. So when the shoulder muscle contracts, the beginning of the shoulder muscle on the humerus will be a fixed point. When this muscle contracts, the forearm will bend and therefore the point of attachment of the shoulder muscle to the ulna will be mobile. If a person hangs on the bar and begins to pull up, then a number of muscles, including the shoulder muscle, will contract. The movable and fixed points change places. The fixed point will be of the forearm and the movable point will be on shoulder. Intermuscular connective tissue continues into the tendon through which the muscle is attached to the bone. Muscle fibers always grow together with the bone directly through the collagen fibers of the tendon connective tissue. In connection with the attachment of a muscle to bones, two questions arise. How does the muscle connect to the tendon and how does the tendon connect to the bones? So, a tendon is a dense fibrous connective tissue cord with which the muscle begins or attached to the skeleton. The tendon consists of dense fibrous connective tissue, mainly of collagen fibers, which fold into first-order bundles. Tendon bundles of the first order are connected into bundles of the second order. The latter, in turn, into tendon bundles of the third order. Finally, the tendon is formed as whole by the so-called intertendon and exotendon connective tissue sheath, the inner and outer peritoneum. Peritoneum, tenon, it's tender in Latin. The stronger the muscle and the more its functions, the relatively less peritoneum tissue, is the tendon, the more collagen tendon fibers in it, and the greater the strength of the tendon. So the calcaneal tendon or Achilles tendon does not break under a load of up to 400 kilograms. The tendon of quadriceps femoris muscle can withstand a weight up to 600 kilograms. When this muscle is overstrained, the tuberosity breaks off, but the tendon itself does not break. If the tendon of the muscle is in form of a white and thin layer, then it's called a tendon stretch aponeurosis. I repeat, tendon thin layer aponeurosis. You may see the aponeurosis of internal abdominal muscle. It's late and thin. So, the muscle as an organ has a complex structure. The muscle includes not only striated muscle tissue, but also the connective tissue that forms the stroma of the muscle, tendons, and blood vessels. Muscles are subordinated to the nervous system through motor and sensory nerves, which branch and end at motor endings. Muscle fibers, like muscle in general, have a characteristic brownish-red color depending on the pigment content. Not all fibers are the same in structure. So, I repeat something, and next we will talk about types of muscles. Let's repeat. Muscle fiber is a structural functional unit of skeletal muscle tissue, includes myosymplectus and myosatellidocyte. In letter 1 you may see myosatellidocyte here, and you may see myosymplast here on this picture. All of them form muscle fiber, the structure functional unit of skeletal muscle tissue. And let's talk some about internal anatomy of myofiber. You may see that sarcomere is a structural contractile unit of myofibers, which is a complex of several proteins. A sarcomere is a section of muscle fiber between two adjacent Z-line. You may see Z-line in black. You may see in zoom Z-line, two Z-lines, and also you may see the unit of myofibril that calls sarcomere between two neighbor Z-lines. And you may see that it contains from next several zones. Here you may see zone A, H, and I. And what we can talk about these zones. You may see two Z discs and one sarcomere between Z two neighbor Z discs, and also you can see myosin protein and actin proteins. So myosin protein it's in red and actin proteins it's in pink color. And in common, the principle of skeletal muscle contraction. You may see two Z-lines in green, and when myosin goes into interacting space, like on this picture, we have muscle contraction because the distance between two Z-lines become shorter. So detailedly, you will study this process of physiology and the micromorphology of these sarcomeres. You detailedly will study on histology. But now we will talk about three main types of muscle fibers. Type 1. Type 1 fibers are red muscle fibers, are characterized by a high content of myoglobin in cytoplasm, which gives them a red color, a large number of sarcos, a high activity of oxidative enzymes, succinate dehydrogenases, and a predominance of aerobic processes. These fibers have ability of slow but prolonged tonic contraction and low fatigue. Fibers type 2. White glycolytic, characterized by relatively low content of myoglobin and high glycogen. They have a larger diameter, fast, titanic, with a great force of contraction, quickly get tired. You may see these fibers in letter 2. So next type second A fibers, intermediate, fast, fatigue resistant, oxidative, glycolytic. It's the intermediate fibers between red and white. In humans, most muscles contain both white and red fibers, but in some muscles, for example, gastrocnemius muscle, you may see on this leg, white fibers prevail, and in others, for example, soleus muscle, it's situated deeper than gastrocnemius, at the part of musculus triceps surae, um, prevail red fibers. So next we'll talk about axillary apparatus. First we'll talk about fascias. Fascia is dense fibrous connective tissue membranes that cover individual muscle or their group, forming fascial sheets in them with openings for the passage of vessels and nerves, with the exception of the fascial muscles. They separate the muscles from the skin and eliminate this displacement of the skin during the movements of the contracting muscles. Delimit muscle, contributing to their independent contraction. Fascia contributes to muscle contraction in a certain direction, preventing its displacement to the sides. The fascia saves the force of muscle contraction but eliminating friction between the muscle during contractions. The fascia stretches large veins under tension, as a result of which blood from the periphery is go to veins. When the fascia relaxes, blood is directed to the heart and valves prevent it from flowing back to the periphery. Fascia are sealed receptacles for muscles and are important as barriers preventing the spread of infections and tumors. The fascia serves as the site of the origin or attachments of muscle fibers. Up to 40% of muscle fibers can begin or attach to this fascial scaffold. Therefore, the fascia can serve to transfer muscle forces to the bony levers and are called the soft skeleton. If the integrity of the fascia is violated, the muscles bulge out in this place, forming muscle hernia. In the intermuscular spaces, mainly on the limbs, there are fibrous sheaths of the passage of nascent vascular bundles. During surgical operations, the fascia helps to determine the location of the muscles, blood vessels, viscera, being the guiding milestones for the surgeons. Famous Russian surgeon Pirogov paid special attention to this. Fibrous sheaths are used to administer anesthetic agents. In this case, local anesthesia occurs due to the shutdown of the nerve trunks in the cases. Generally, the stronger the muscle, the stronger the fascia. For example, the area of the limbs, it has a spatial strength. If the muscle are arranged in several layers, then the instituting fascia is split in two planes, superficial and deep. In some places, its own fascia forms processes between muscle groups, intermuscular septa, which penetrate deep into the groove together with the periosteum. Therefore, there are two types of muscle vagina, fascial and osteofascial, formed by fascia and bones. In some muscles, for example, in the gluteus maximus, the fascia has lamellar processes that penetrate between the individual bundles. The axillary organs of the musculature includes the bursa. These are closed cavities filled with synovial fluid which are located between muscles or tendons and various bony protrusions. You may see also deltoid bursa between deltoid muscle and uh, greater tubercle of humerus. The bursa eliminate bone friction of the muscles and tendons, and they move during muscle contraction and relaxation. By location, they are divided into subtendinous, like this, uh, usually located on the limbs between the tendons. Subaxillary, located in the area where the muscle is adjacent to the large bony protrusions. Subcutaneous, you may see here, are located on areas of the body experiencing significant friction or pressure, for example, bursa of knee joint. Subfascial bursae located between the superficial and in-string fascia. For example, such a bursa is front of the patella. Excessive accumulation of synovial fluid or infection is called bursitis. Synovial uh, sheath of the tendon is boot-like two-layer tube. Uh, consists of two layers, outer fibrous and inner synovial. The outer wall is spliced with the wall of the fibrous or fibrous bone canal in which the tendon is located. This wall is called parietal leaf. The inner wall, the visceral leaf, is fused with the tendon. The surfaces facing each other are lined with epithelium. Between the leaves is cavity filled with synovial fluid. In the place where friction is the weakest, the parietal leaf is connected to the visceral, forming the mesentery of the tendon, the mesotendineum, along which the vessels and nerves pass into the tendon. You may see also synovial vagina um, with two layers, and this axillary part um covered the biceps tendon here. Next, muscle block and sesamoid bones. So muscle block located in the place where the tendon changes its direction. Thanks to the block, the tendon does not move to the side. This is a bony protrusion, the rubbing surface of which is covered with cartilage. As a rule, there is a synovial back or bursa between the block and the tendon. For example, the passage of the tendon of long peroneal muscle, you may see on this picture, under the peroneal block of the calcaneus. And sesamoid bone is located in the thickness of the tendon close to this place of its attachment, for example, patella or kneecap. It's situated in the middle of tendon of quadriceps muscle on thick. So let's summary skeletal muscle functions. Contractile, proprioception, its muscular articular feeling, effect on bone shape and development, the formation of the walls of the cavities, effect on blood circulation and lymph flow, thermoregulation, depot of salts, water and glycogen and oxygen, adenosine triphosphates synthesis is the main energetic substance in our body. Principles of muscle classification. We taught that muscle classification are related to various characteristics. First, in relation to areas of the body, distinguish between the muscles of the trunk, head, neck, limbs, muscles of the trunk, back, chest, abdomen, muscles of the limbs, girdle and free limb. Next, by origin, and I told you autochthonous, truncapital and truncafugal muscles. Next, by form. The simplest form of muscle is fusiform. You may see fusiform muscle here. In them, bundles of the muscle fibers lie next to each other. For muscle of the shape, it's characteristic that its abdomen at the beginning and the end point or attachment passes into thin tendon. You may see thin tendon here. There the tendon is short, it's the head of the muscle. The fusiform muscle may have not one but two, three, or four heads, biceps, triceps, and quadriceps. And for example, you may see the biceps muscle of an arm. Muscles can have a ribbon-like shape. These are long, prismatic-shaped muscles in which the muscle bundles are put next to each other. Broad, flat muscles often end in broad, flat tendons or tendon sprains upon neurosis. There are also such muscles in which the direction of individual muscle bundles does not coincide with the direction of the entire muscles as a whole. The direction of the individual muscle bundles does not correspond to the direction that the muscle as a whole develops. There are the so-called pinnate muscles. The muscles bundle that forms them are directed at an angle to the general traction of the muscle. A tendon stretches along the edge of such a muscle to which oblique bundles are attached from the side. There are unipinnate, bipinnate, and multipinnate muscles. In unipinnate muscle, a tendon stretches along the edge of it, and muscle bundles are attached to it on one side at a greater or lesser angle. In the bipinnate muscle, the muscle bundles are attached to a long tendon on both sides, at an angle to the direction of the tendon. Some muscles, for example, the deltoid muscle, have a complex pinnate structure. The tendon, as it were, forks into several tendons that grew into the muscle. Muscle bundles are attached to them from outside. And also you may see triangle-shaped muscle, digastrical muscle, flat muscle with aponeurosis, square-shaped muscle, serrate-shaped muscle, and also you may see multisegmental muscle with tendinous septi between each of them. This is musculus rectus abdominis. It forms the anterior wall of abdomen. By function, muscles are divided into flexor, extensor, abductors and adductors, instep supports, outward rotation, supination, pronators or invert rotators, sphincter, dilatators, levators, depressors, and other. Its functional classification. So many muscles perform their functions more complexly, being in relation to each other either antagonists or synergists. You may see these terms on this picture. So the biceps muscle of the shoulder together with the pronator teres flexes the forearm. They are synergists in this flexion, but at the same time the biceps can rotate the radius outward and the pronator teres inward, and then they are antagonists. Different parts of the same muscles can perform different functions. For example, the anterior bundles of the gluteus maximus rotate the hip inward, the hind ones are outward, and if the entire muscle contracts, then the hip is abducted. By position, distinguish between superficial and deep, external and internal, lateral and medial. In relation of the joints, single joint, double joint, and multi-joint. You may see on this picture these terms. So these muscles depending on how many joints they act on. Polyarticular muscles are usually longer and more superficial. So let's talk about muscle work. Biomechanical elements. Biomechanics is a science that studies the movements of the musculoskeletal system according to the laws of mechanics, establishes the strength and mechanical properties of tissues. It allows you to establish the condition under which work is most efficiently performed in the process of contraction of muscle groups. In all parts of the body, the muscles are located so that contraction of one muscle shifts the point of attachment of the other, prepares a greater angle of approach of the tendon to the bone. This significantly increases muscle strength with the least energy expenditure. Thus, due to the layered arrangement of the muscle, with a relatively small amount of muscle tissue, a person can perform significant work. A similar design feature was developed in the process of evolution. The body did not follow the path of increasing muscle mass, but changes in the location of the muscle took place in order to create conditions for increasing the tone. Muscle strength depends on several factors. First, the force that a muscle develops during contraction consists of the forces of contraction of muscle fibers. Therefore, it's proportional to the number of fibers that are in the muscle. If a cross-section is made through the fusiform, ribbon, or flat muscle, where all the fibers are located next to each other, then it will pass through all the muscle fibers. Consequently, in the muscles of a simple structure, the strength of muscle is proportional to the area of its anatomical diameter, its thickness. The anatomical diameter of pinnate and other muscles of a complex structure cannot characterize their strength. It's here characterized by the concept of physiological muscle diameter. This is an imaginary plane of which the cross-section of all the muscle fibers that make up the muscle are located. The physiological diameter of muscle is proportional to its strength. What strength do muscles of certain diameter have? Numerous studies have shown that which diameter of 1 centimeter muscle strength is maybe 310 kilograms. In other words, the contraction of such muscle can hold a load from 3 to 10 kilograms. Second, the strength is greater the greater the area of support of the muscle on the bones, fascia, or other muscles. From the value to the angle at which the force acts, cross muscles contract more strongly than when they are parallel. From the site of muscle application, on the degree of arousal under the influence of the central nervous system. The features of the muscle functions also determine the features of the composition of the fibers involved in muscle building. Muscles that contract for a long time and with great force consist mainly of red muscle fibers. The deep and superficial muscles of the back, the muscles of the pelvis, and the diaphragm have a such structure. The muscles that perform shorter contraction carry out quick and dexterous movements are mainly composed of white muscle fibers. This is how the sternocleidomastoid muscle and the muscles below the hyoid bone are built. The work that a muscle produces during contraction can also be uneven. It can be overcoming, holding, and yielding. This is best illustrated with a deltoid muscle, for example. When the arm is abducted to shoulder level, this muscle by contracting overcomes the resistance of the arm's weight. Consequently, the work of a muscle can overcome this or that resistance. Further, the deltoid muscle, having performed abduction in shoulder joint, can hold the arm motionless at shoulder level. At first glance, the deltoid muscle does not work. But try to stand like this for 5 minutes, and you will feel fatigued, as the deltoid muscle is doing a very difficult holding job. The abducted hand falls when the deltoid muscle relaxes, but you can also gradually abduct the hand while the deltoid muscle performs pliable work. In the process of coordinating the function of the flexor and extensor, flexion and extension are carried out in concert. The flexors, when flexing, perform an overcoming force, and the extensor, pliable work. If in violation of the function of the motor analyzer, the cerebral cortex, and other nervous apparatus, the coordinated work of the antagonist muscles is disturbed. The movements lose their smoothness and accuracy. A patient suffering from muscle coordination disorder grabs a glass, brings it to his mouth with careless movement, but hits himself in the teeth or carries in past the mouth or drinks splashing water. The work of the locomotor apparatus as a system of levers can be represented as a fulfillment of the laws of mechanics. Types of levers. Depending on the location of the driving force, muscle contraction, and the resistant force relative to the axis of rotation, levers are distinguished. A lever of the first kind, balance lever, two-armed lever. The fulcrum is located between the points of application of the forces. The equilibrium condition is the equality of the product of the magnitude of the force by the length of the shoulders. For example, this is atlanto-occipital joint. A lever of the second kind, lever of force, one shoulder. Here the point of resistance, center of gravity, lies between the fulcrum and the point of application of the force. An example of such a lever is the foot. The place of support is the head of the metatarsal bones. Gravity is transmitted through the shin bones to the talus, thereby lowering of the foot. The pulling force of the triceps muscle going up from the calcaneus has a larger shoulder than the shoulder of gravity. The third kind is speed lever. The point of application of the muscle traction is near the axis of rotation, and the muscle traction shoulder is less than resistance shoulder. An example is an elbow joint during flexion. The fulcrum lies in the elbow joint. The point of application of the force in the area of tuberosities of ulna and radius, here, slightly ahead of the fulcrum. The point of resistance is in the distal end of the forearm, above fulcrum. Such leverage results in gains in speed but lost in strength. Types of muscle work. From the standpoint of biomechanics, the work of muscles is determined if it moves a part of a body or gravity and any distance. In reality, the muscle does the work starting with the slightest tension. Therefore, it's divided into static and dynamic. During static work, part of the muscle's training seeks to balance the movement of gravity. It's expressed in holding the body or its parts in certain position. At the same time, the muscles do not shorten, do not lengthen, but only strain. Important here. Pliable work of muscle, since consistency depends on it, coordination of work of muscles of opposite action antagonists. The holding work of muscles, since it's that determines the posture of the body, fixes the joints, holds the parts of the body in certain position relative to each other. During dynamic work, body movement occurs associated with a disparity between muscle and mechanical forces. It's carried out overcoming and pliable forces. With the overcoming work, muscle force is greater than opposing force. As a result of contraction, movement is made. Pliable work occurs when the muscle force are less than opposing movement, and the contracted muscle is stretched. This type is necessary to ensure smoothness and elasticity of movements. If it were not for this regulator, then the movements would be jerkily and purely coordinated. So next we talk some words about abnormalities, and I told you about more often abnormalities, complete absence of individual muscles, the appearance of additional muscles, the absence or underdevelopment muscle or part of muscle, additional tendons, muscle splitting, at last the connection of muscles parts with other muscles. So that's all, dear friends. Thank you for your attention. Goodbye. See you again.